It's always fun to.
Good evening, everybody. Welcome back. It's another Monday night with Mondays with Maishi. This is Moshe Norman from Lakewood, New Jersey, on tonight with a very special guest, one of the experts in the field, as we always like to have, one of the experts of the field on solution-focused therapy or solution-focused brief therapy, depending on whether it's brief or not, right? But solution-focused therapy. And tonight we have Teri Pichot from Denver, Colorado. Teri, I'm going to have you put your website in the chat box, or actually I'll just copy and paste it if you want.
Perfect. That would be great. Thank you.
And we'll do that again later. Teri, thank you very much for agreeing to come on and share your expertise with the hundreds of mental health professionals subscribed to Mondays with Moshe. Actually, we're about 1,400 or 1,450 at this point, 3 years in the making. So there's a really nice crowd who will join us tonight and who will be watching this show afterwards. So we really, really appreciate that you came on and agreed to share.
Well, it's been an honor to be here. Looking forward to it.
Amazing. Okay. Teri, just, we're talking about solution-focused therapy. It's different than some of the cognitive behavioral therapy. It's different than the psychodynamic, psychoanalytic therapy. It's different than the relational and interpersonal therapy. It's sort of its own, I don't know, maybe would we put it closer to behavioral, can we say? Or, okay. So you're going to tell us a little bit about which classification, for those of us who need to put it near some box, you'll tell us a little bit about it. But before that, just tell us who you are. How did you end up in the world of Insoo Kimberg and Stephen DeShazer with Solution Focus? How'd you get into this field, and what's the history behind that?
Well, like many good things in life, it was completely by accident that I got into solution focused practice. I was originally trained as a drug and alcohol counselor in the late 80s, and I picked drug and alcohol counseling not because I necessarily had a great passion for that population, but because I really always want to do my very best and get really good at what I do. And so I thought about who would be the most challenging population that I could imagine. And I thought if I could help somebody who had lost their family because of their behavior, their job because of their behavior, their housing, their freedom, all of these kinds of things, and who could still look me in the eye and genuinely say, nope, no problems here, then I could help anybody. And so that's why I went into the field of addiction. And then once I got into the field of addiction, I fell in love with the population, that they're just really cool people. And yet what I did not like is I did not like working with the other professionals. Specifically with drug and alcohol counseling, there was definitely this feel that the professionals were right and the clients were wrong. And if the clients disagreed, it was part of their pathology. It was part of their denial. It was part of the disease of addiction. And I wasn't very comfortable with that idea that we were always right as professionals, and by default, the clients were wrong. So from there, I went on to work in the domestic violence field. I worked in domestic violence shelters for a little bit, and yet I found that same dynamic, this idea of that we as the professionals were right. So when the people would call in the middle of the night after they had been battered, my job was to try to counsel them to leave their partners, meet an unmarked car in the middle of the night, and wait in a phone booth as we pick them up. And reality is most of those people didn't want to leave their partners. Most of those people wanted couples counseling. But again, I was trained to say, we're right, and you not leaving is part of that cycle of violence. It's part of your pathology. Didn't like that.
So something about that lack of self-actualization that wasn't.
Yeah, very much so. So then I decided to work with teenagers, thinking that would be much easier, you know? And what I loved about working with teens is they just flipped you off to your face. They didn't pretend that they thought we were right. They didn't go passive on us. They just told us we were idiots. And I found it amazingly refreshing.
Yeah.
Yeah. And so from there was a workshop that I saw, this was in the early 90s at this point, and it turned out it was all about how to do couples counseling with actively violent couples. And I knew immediately that I had to learn about this, because even though it was very taboo, this idea of doing couples counseling with actively violent couples, it was the first time that I heard an idea about honoring what the clients wanted. So I went to this workshop, and it turned out it was all about solution-focused brief therapy. And the presenter, it was honestly the very first time in my career that I heard somebody say that our clients know what's best for themselves, even if they're not doing it. And our job is not to try to convince them of what we think is right for them, but our job is to create a safe environment so that they can turn on their brain, so that they can explore for themselves what is ultimately right. It was life-changing. Absolutely life-changing.
Amazing.
Now, part of that team, I mean, the presenter was part of a team that every Friday night he would meet with a group of therapists in the Denver metro area, and they would work with actively violent couples using a one-way mirror. And I went up to him and I said, I have to be a part of this team. And he quickly said, I'm sorry, we don't have room. But at that part, I was really desperate. I knew there was no way I was going to be able to survive in this field if I didn't do something different. And so with a lot of persisting, he finally said I could come, but I had to shut up and sit in the corner behind the one-way mirror because they were busy, they were full. And that was good enough. So I came every Friday night and I sat behind the mirror and I saw the most incredible things happen.
So tell me, what did you see happening?
I saw couples that initially were so angry, and if you read their police report, it would curl your toes, the things they did to one another. But when you met them, they were good people. They were no different than you or I. And the majority of them healed their relationship. Not all of them, just like in real life, but there was never, ever any incidences of violence in between sessions or during sessions. It went completely against everything I had been taught.
Mm-hmm. I mean, I think that speaks true for all psychotherapy, in that we look to empower the client and have them sort of develop themselves, contrary to some of those other disciplines you mentioned earlier. But there seems to be something about the energy or something of solution-focused therapy that you bought into or seemed very organic to you. Can you share a little bit about that? What was it specifically about solution-focused work?
Well, in the drug and alcohol fields, motivational interviewing had already come into play, right? And motivational interviewing was a kinder, gentler, softer approach, but it still had that subtle belief that we as the professionals are right, and the client is not ready to understand that we are correct, right? So there's still that power differential. It's a softer power differential. Solution focus does its very best to narrow this power differential. We can never completely get rid of it because we are in the position of a professional versus a client. There might be gender power differentials. There might be cultural power differential, age differentials, but we do our best to get rid of it. And so when I was working in the domestic violence field, there always was a belief that the victim should leave the perpetrator, always. Now, oftentimes they use motivational interviewing kind of approaches to try to help the victim to identify that. But solution focus was different. The only agenda that is in solution focused practice is to create an environment so that the client can genuinely determine what is best for themselves in the context of their life. So there is no me trying to motivate. There is no me trying to get them to see something. There's no such concept of, is somebody ready for something? It's a genuine curiosity, which I had seen a lot of people talk about curiosity, but I had never seen anybody genuinely live curiosity. Those are radically different.
Okay. And so you talk about solution focused being very, very, I guess we would say client-centered in that way.
Yeah, it's probably the most client-centered I've ever seen. And as a social worker, most of my training is in client-centered, and yet it was nothing like what I learned from Insoo and Steve themselves.
What do you mean by that? What did you learn from them that was?
Again, this genuinely being curious and not having an agenda for outcome.
Mm-hmm. So what is it that we're curious? We're doing solution-focused therapy. What is it that we are curious about? What does the client bring to the table, and what do we become curious about?
Yeah. So what I'm really trying to become curious about is when things are how they want them to be, what would that look like in the context of reality? So it's not magical. We're not looking for, like, a magic wand is not part of solution focused, anything like that. We're really looking for, if I could lift out this thing that is troubling. So like in the domestic violence, if the relationship was how they would both want it to be, what would that look like? Mm-hmm. And it has to be both. It can't just be one.
Mm-hmm. Well, that's
right?
in a relationship, but we can use
mm-hmm.
focused brief therapy on an individual.
Yeah,
and
for
so
sure.
If a person were to describe, reducing anxiety or depression, I'm assuming what I'm hearing from you is that the idea would be to have them visualize or imagine what the end result would look like.
Well, let's take like one of those. Like I always say, anxiety has a job. So we never want to get rid of anxiety altogether. If anxiety wasn't there, I wouldn't have shown up for this call on time, right? I wouldn't have made sure things were ready. So in the future place, I would ask the person, what would it look like if anxiety was doing its job and was not getting in the way for you?
Oh.
Okay, that's what I would ask for someone who was struggling with anxiety. Someone with depression, we all have ups and downs. We all have good days, bad days. Bad things happen to all of us. So it's not about getting rid of depression. It's about, if things were going well in your life, what would it look like on a down day? What would it look like on a dark day?
So that's
right?
if things were going well,
yes.
What would a bad day look like?
Exactly, because otherwise it becomes this toxic positivity thing, which is not what solution focused is at all, right? Like we can all imagine what it would be like if life was perfect with no problems. That is not a helpful conversation. That has no part in solution focused practice. Solution focused practice is really looking at, on a day-to-day experience, if things were going well, what would that look like? What would it look like when your alarm doesn't go off and yet it's still a good day? What would it look like when you get into a conflict with someone you love and yet things are still good and your partner or this loved one still agrees that things are good despite the conflict?
I see. So I'm imagining, and again, correct me if I'm wrong, but I'm imagining that if the client succeeds to describe that image, we then probably have to ask them how that can happen. So
that's problem solving. That's different, okay. Right?
So how do so we've identified that bliss. Okay, if things can go really well, then on a dark day, this is how it would go. Must we ask them, how do we get there?
That's problem solving. So this is the biggest difference between all of the other models. The only other theoretical model that shares the same way of thinking is narrative therapy. All the others have the foundation of problem solving. Problem solving is exactly what you said. We try to figure out, okay, we have this goal. How do we get there? That's problem solving.
Okay.
Solution focus is radically different. We really help them to imagine it is already there, and we work backwards. How did they do it? And it sounds like a small shift, but it is completely different. Because when we ask someone who's stuck, what do you need to do? They will almost always say, I don't know. If I knew, I would have done it. But if you have them to imagine how they want it to be and then get curious, how might they have done it? You're inviting them into a curiosity place, to a place of imagination. It gives hope.
Because it's not how they will do it. That's too confining and too overwhelming. But in the imagination, anything can go.
That's exactly right. They start thinking outside of the box. It's empowering. It sends the message of hope. Of course you can do it.
And they're also not committing themselves to doing it because they're just imagining. So it sort of takes away the tension and the pressure. Okay. So the idea is the same, but it's a different way of communicating in a way that makes it less threatening and less scary.
Yes. And it's problem solving is trying to get rid of the problem. We're not trying to get rid of the problem. That's not what we're doing. We're trying to create a preferred future. Those are radically different. Like when we work with people who have chronic mental illness, the problem is probably never going to go away, right? It's not about resolving it. It's about creating a preferred future. If things were good despite that, what would they look like? So there's a radical difference between trying to get rid of a problem versus creating a preferred future in the context of reality. Very different.
Excellent. Okay. Let me just allow me to make a couple of announcements before we continue. First of all, I just want to request for those of you who could turn on your videos. We always love to have people on video. It makes it more personal, and we get better feedback that way. And of course, we feel more connected to the crowd and the participants. So please, if you can, please turn that on. And for those of you who have questions or comments about solution-focused therapy, please just tap the reactions tab on the bottom right of your screen and raise your hand, and I'll call on you, and Teri will be glad to take your questions. Of course, I have many more questions and discussion about this. This is very exciting. So we can proceed. I did want to also mention that Mondays with Maishi is now sponsored by OKclarity.com, which is the only online platform for wellness professionals who work within the firm community, to be found online. Their innovative directory allows users to search for therapists, psychiatric medication providers, coaches, and nutritionists for free. I'm proud to have my very own OKclarity website, where potential clients can find me or simply learn about all that I do, even if I'm not currently looking to grow my private practice. As a therapist, you know how we despise marketing ourselves. Enter OKclarity, who does this for you in a professional and classy manner with actual results. So I do encourage you to check them out at OKclarity.com. Okay. Just want to thank Shandel for turning on her video. And for those of you who can, please, we'd love to have you on. Okay. Teri, so I shared with you that I'm a psychodynamic therapist, and my preference and my nature sort of draws me to dynamic work. Okay. And I also at the same time appreciate other modalities, other systems of therapy. Something like solution focused just seems, from a logical perspective, it seems very rational. It seems very hopeful. Something that's more psychodynamic often feels more dreary and morbid. But here's a question that I'd like to understand from you and from those of you who practice these kinds of therapies. Suppose we have a person imagine, and they're fantasizing, they're imagining, and I'm sure that creates, in today's language, we say that creates some new neural pathways in their brain. But we have another problem, which is the inhibition of relational trauma, the inhibition of personality trauma, those kinds of inhibitions that prevent a person from really being able to actualize and push forward in some of their dreams, fantasies, plans, things that cause them to procrastinate, trauma that causes them to avoid, right? And so, can you share with me, can you encourage me that by just thinking solution focused, just imagining that in some way is going to bring me out of my own anxiety, fear, terror, to move forward when I am so scared to, because I'm scared of failure, or I'm scared of shame, exposing myself because of some of my child of origin trauma.
Mm-hmm.
And I'm sure you've heard this question before.
Yes. So much of what we've talked about so far is just the tip of the iceberg, right? This is, as Insoo Kim Berg used to always say, this model is so simple, but it is by far one of the most difficult models to learn, because it takes discipline to learn to stay this simple. So, there's so much to really learning this and doing this well. And the kind of client that you just described would take someone with great skill using this, right? But now let me use an analogy. I think the more we use analogies, it helps us really understand these concepts better. So what you just described would be akin to someone driving their car in very heavy fog. We can still go forward when there's heavy fog, but we can't see really far into the future. So someone who's really struggling with past traumas or crisis or chronic mental illness, I'm not going to ask them how they want their life to be a month from now or 6 months or a year from now. I'm going to ask, suppose you got through today. What would that look like? How would you have done it? Right? I'm only going to go as far into the future as they can clearly see. And keep in mind, people do not change from description. When I teach professionals, I oftentimes have them use their own stuff. And I always say, we all know what we need to do, but we're not doing it, whether it's exercise more or eat healthier or whatever it is, right? So change never happens from description. That's not what creates change. What happens is from what we call process hows, which is, how would you have gotten yourself up off the couch? How would you know it is time? That's where change comes from. So someone like the client you just described, I'm not going to go very far into the future. That's why this works so well with some of the most severe kinds of things, because we're just being with the person right there, but getting curious about what would a good day look like for them, given everything that's on their plate. How would they have decided? Do they get out of bed today or do they not? So very basic kind of stuff.
I think I'm still struggling to understand, even if they can articulate that and imagine it, but when it comes to it and it comes to feeling so overwhelmed by the world, let's say, I know I have to get up and do these tasks. Talk about a procrastinator. I know I have to get up and do these tasks, and this is how I would. And this is how I would pull myself together. This is how I'd get off the couch to do them. This is how I'd write a planner and keep to it. And then once they have to face that, and it just feels so overwhelming, how are we bridging the gap from that fear, that paralysis?
Right. Well, solution-focused session has 3 fairly equal parts. So far, we've only talked about the first part. We haven't talked about the other parts. So there's 3 parts. That's what do you want, what do you have, and what's next, right? And every single session has to have all 3 parts. It's very much like driving a car. Every time you drive a car, you got the starting up, the driving, the parking. You have to do all 3 parts. So what we've talked about, what do they want, is that first third. The second third is about, what do you have? What's keeping things from getting worse? Right? So really pulling out, what do they know about themselves? What is keeping it from dipping lower, or has it dipped lower? And how have they turned that around? Do they have moments when it's a little bit better? How do they do that?
So have us in resources. What resources do they have that have pulled them through in the past? Yes.
Yeah, we don't like labels in solution focused. So that's why I'm not like, yeah, it's resources. I mean, technically, if we're going to translate it back into problem focused language, we would call it resources.
Yeah.
We're solution focused. We work really hard just to do what we call talking normal, just using everyday language, no jargon, no labels. So just really, what do they have? What do they know about themselves? What works for them? Right? And to pull that out. The last third is about what's next. It may not be time to move. It may not be time to move forward at all. Right? So one of the biggest mistakes that I see people make when they're learning solution focused practice is they try to go too fast. Steve Deshazer used to always say, by going slow, you go fast. So a lot of the questions I would be asking with this client that you're talking about would be, how would you know it was time to take action? What would let you know it is time? Not what action would you take? See how that's pushing forward. We want to really match clients at their pacing. So much of solution focus goes very consistently with the laws of physics. And oftentimes we as clinicians don't think much about physics, and yet physics is alive and well in all of our conversations. And remember the physics principle, for reaction, there's an opposite and equal reaction. So if I try to move my client forward, the opposite and equal reaction I can expect is for them to tell me why they can't do that. Right? So it's really important I don't ever try to move a client forward. Instead, I want to sit down beside them and simply get curious about them. They will move when it's time, and they're much more likely to move forward if I have no intention of trying to get them to move forward.
Yes. I mean, I would add to that if the more comfortable you are with them staying where they are, the easier, the more settled and valid they feel, which enables them to now step out of the box and move forward.
Yeah.
So, I mean, to me, that sounds very person-centered or client-centered. That was, part of Roger's model.
There are some similarities. I always say we're going to learn the most about models if we look at how they're different. Because we'll see a lot of ways things are similar, but just like a pair of identical twins, the more you focus on how they're similar, the more confused you will be.
Right.
If you focus more on how they are different from one another, then we can learn to value them both.
That's great. Okay. Just want to remind you, if you have questions, please hit the reactions tab on the bottom and raise your hand. I also, Teri actually offered to do a little bit of a model brief session, right? Partial session. If we have anybody who would volunteer, be brave enough to volunteer to be a client, please think about that, raise your hand, and we'll certainly take you as a client so we could kind of see this in action. I also want to give a special shout out and thank you to Shopsy Sorcerer, who I believe is here. Was here yet, still here, for connecting us with Teri. I think Shopsy is a student and an avid follower of the model of solution-focused brief therapy. So thank you for that connection, and good to see you and good to have you here. Shopsy, by all means, if you want to raise your hand and ask a question or give some input, we'd love to have that too. Okay, so I'm still trying to wrap my head around. We have the how question, right? The what
process house, description and process house.
And so that looks like how what? How would you imagine something being at the time that it's a dark day, things aren't working out perfectly, and still it's okay? That's
the description. The process how is like bringing it to life. Think of description as like if we were to take a photograph of it. You have no idea how anything fits together or how it's moving. The process how questions turns a still photograph into a movie where we can now see how it works, how it moves together, how decisions are being made.
Okay. And then after that, we have the What do you have?
Mm-hmm. That might be through scales. We might ask exception questions. We might ask coping questions, but we're really taking a look at what is it that is working in the client's life? What is that the client's bringing into the room?
And then the third part
is what's next. Imagine things were just a little bit better, just a little bit. What might that look like? How might they have done that? So again, you hear the description and the process how questions come in.
Okay. Teri, I want to ask you a question.
Mm-hmm.
In your world, in your world perspective of the psychotherapeutic process, what do you see as the ingredient that's cultivating or enabling change to occur?
I have no idea. You'd have to ask the client. I don't have this is where it's so radically different, is that solution focus is one of the very few theoretical models that does not have a theory. It is not a theory. It's a meta model. So in a theory, you're right. There is a hypothesis of what's causing pathology. There's a hypothesis about what's causing change. That's a theory. Good. Solution focused is a meta model. And what I mean by that is we pull the theory from the individual client. So if I can use an example, let's use a drug and alcohol example. I ask a client, how can I help? And one client says, I come from a family of addicts. I've got to stop using. I have this disease that's going to kill me. Do you hear the theory that's coming from the client? They have a disease. They need to stop using. So I'm going to pull that theory and build that into my question. So in this future place, what would that look like? How would you stop? Would you never use again? What would that look like as I build on that theory? Now, let's say I have a completely different client that comes in and I say, how can I help? And this client says, I drink too much. Like, okay, so how can I help? They say, it's just a bad habit. In college, we used to have these big parties and I just started, doing these big binges and it's just a bad habit. You hear the client's theory? So solution focused, I'm going to pull that theory and use the client's language in my questions. So in this future place, what kind of habits would you have that lets you know that this is working? Would you use alcohol? Would you not use alcohol? If so, how much? How would you decide? Now we have a third client that comes in. They say, how can I help? And they say, I drink too much. How can I help? Well, I have these flashbacks. I was abused as a child, and the only thing that helps me sleep is to drink. I don't really think I have a problem with alcohol, but it's the only thing that helps me sleep. You hear the client's theory? So solution focus pulls that theory forward from the client and steps into their world. And then I might say, so in this future place, when you are able to sleep and you feel good about how you're doing that, would you drink? Would you not? How would you be managing these thoughts about what happened in the past? How would you decide when to pull those thoughts out and to think about them versus to say, nah, I don't want to really think about those right now. You see here how these are three very, very different theories, but the theory of change and the theory of pathology always comes from the client, never from me in solution-focused practice.
I mean, what I'm hearing you say is the client's going to design based on their theory. They're going to design their own path towards change.
Very much so.
That's what I'm hearing you say. But I'm not hearing. So again, what I'm hearing you say is that the client sort of is independently and autonomously choosing their change process.
They're going to do it with or without us.
Well, without us, they might not change at all.
But they still have the same theory.
But how does the theory is not what's helping them to change. It's the choices that they're making that you're facilitating their thinking process. You're disagreeing with that. But
I don't know.
that's not even where my question was. My question
Okay.
wasn't even in it, that. I understand that point.
Yeah.
You may have a different language to say what I'm saying, but I'm wondering if this is even true at all. That what, in other words, can we step away from solution focused therapy, because
Sure.
that's going to be contentious, right? And how we see it, we view it, and you're going to catch me on my lingo because I don't have the expertise in it. Let's go somewhere else. Let's go to cognitive behavioral, right? Or let's go to emotional focus. I don't know, right? I think what many people would believe is that it's not the actual therapeutic model that's the cause of the change, but it's more about the therapeutic alliance or the relationship that induces the change. And so, and what do I mean by that? Well, in your case, what I'm hearing in this very client-centered style, the client is, okay, let's take a step back. The client is presumably judgmental upon themselves because they're doing something that they don't want to be doing, and they can't stop themselves, or they can't get themselves to do what they ought to not be doing or ought to be doing. So they're frustrated, they're down on themselves, they're upset, right? And when the therapist steps into the role of understanding, like you very much, you very eloquently described in your model, right? The therapist is actually providing the client with tremendous credibility, right? We trust in you, we believe in you. How so? Because look how well I can understand you. That tells me that you make sense, which in my mind dissolves a lot of that anger, a lot of that self-loathing, a lot of that tension. And then when you're moving solution focused, that's almost a tool we move forward. So what I'm asking is, I guess, would you agree that even in solution focused therapy, the main ingredient of the therapy is not what the client chooses to do or how they choose to make change, but in the therapist's acceptance of the client, that sort of enables them to break out. And then if they break out, we can use all different kinds of tools to get there. It could be solution focused, it could be cognitive behavioral, or something else. Or do you see the change happening within the model itself of how we're facilitating the thinking of the client? But if this were to be done by a computer or a dog, like we discussed earlier, the same process might occur because they don't really need a person.
I definitely disagree that we might not need a person. I mean, I like the research that looks at all the different theories to say what is really creating change. And what it shows is that 87% of our chance for change comes from what's called extra therapeutic factors. Means it has nothing to do with relationship, has nothing to do with our model, has nothing to do with hope and placebo. 87% of our chance for success, no matter what model you're using, comes from what the client is bringing in the room. So what I'm talking about there and what that research is talking about, it's the client's belief system, the client's way of thinking, everything about the client. So that's what that research shows. Now, let's take a look at...
Can you just elaborate on that for a minute so I understand what that means? I mean, so I'm a client that come into a room, I don't believe in myself at all. I'm 40 years old and I failed at everything I did. And I've never had a successful day or a happy day in my life. I'm divorced twice, fill in all the rest of the blanks. And I just don't believe in myself at all. So what are my chances? What are my chances of doing well in therapy?
87%, as long as I don't mess you up. That's what the research shows, right? So my job in solution focus, and why solution focus has such a good outcome measure, is because it really honors all 87%. Because when you think about it, there's only that remaining 13% that we as professionals are bringing to the table. It doesn't matter what your theory is, right? It really doesn't matter. So one of the things that solution focus does so well is it really works hard at not messing up that 87%. So I don't challenge your cognitive dissonance. I don't try to get you to change your behavior. I don't try to teach you anything. I get curious about who you are. And even with that scenario you just gave me, you still brought 87% chance of success into the room. And if I buy into your low self-esteem that you brought nothing into the room, then I'm going to change that 87%. And I don't want to do that.
So just to clarify, I didn't bring 87%
chance
of
for
success. I brought 87% of the change, is what you're saying, not 87%. In other words, you said the therapist brings in 13%
of the chance for success.
Yeah, and the
chance for success.
And the rest is not an 87. In other words, I'm not bringing in 87% of the change. I'm bringing 87% of myself in which the change can happen.
And my job is to not mess up that 87%.
And so if you just don't come in the room, then you didn't mess it up. So how do I change? And just help me understand what's...
Yeah. What this research is saying is to not try to change who you are, but to pull out who you are.
Okay.
That's that 87%.
That's what solution focus is looking to do, is to draw out.
Yes, but this is what the research shows in every theory. It's not just solution focused, but why is solution focused so effective? Because that is the mission of solution focused, not to try to change the person, but to get curious and use skillful questions to pull that out.
I see. So let's go back to this this client who has failed miserably at everything. I think. Well, everything.
I don't know if anyone who's failed miserably at everything.
Okay, probably not.
I don't even think it's possible.
Okay, probably not everything. True.
Okay.
But what I think I'm trying to wrap my head around what you're saying. Yeah. There's been so much failure and so much disappointment and so much upset, but that is not at the core of the person. That's just the things that they've done and haven't worked. They haven't worked for many, many variables. Things that were self-sabotaging, lack of skill, lack of, too much impulsivity or whatever, poor choices. And that doesn't speak to the core of the person, is what I think I'm hearing you say. And if we can draw out other variables, other parts of the person, other more hopeful, or again, more foreseeable things, then the person may be able to, on his or her own, develop.
Yeah. I mean, let's go back to physics. Like if I hold up this pin and I focus on this pin, suddenly this pin is larger than my computer screen, right? If I had to hold this pin and stare at this pin, I would not be able to continue this conversation very long. But if I shift my focus back to the screen, I still see the pin, but now you're a very clear focus. I could have a whole conversation like this. It's a little annoying I'm still holding the pin, but I could have the conversation. And I'd probably eventually set the pin down. The same is true with clients. Clients come in very focused on the pin, all of the pathology, everything you just described.
The failure, right?
Right. They're just focused on the pin. Solution focus acknowledges the pin, but focuses them past the pin. How do they want their life to be? So both are true, the story of pain and the story of hope, right? And by focusing them past their pain to what they want, most people will set the pin down. However, not everybody can. Some of my clients with chronic mental health symptoms can't ever set this pin down. But if I can get them to focus past it, they can go through life just fine holding this pin, right?
That's a good analogy.
But that's what we're doing, is I'm not trying to change the pin. I'm trying to really get them to look past it. What do they want? And I'm going to trust if they decide to set the pin down or if they choose not to. It doesn't matter. It really doesn't matter. I'm not focused on the pin. It's a radically different way of thinking because we are so classically trained to focus in on this pin to understand why the pin is here, how long has it been here, how's it negatively impacting it. Solution focuses, yep, that's a pin, and gets them to focus past it.
Amazing. Okay, this is becoming a little bit more clear.
Good.
Thank you for that.
I appreciate your persistence.
Yes, I will. I shall. Okay. I again want to go back to the question of a volunteer. Can we get a volunteer for a quick, brief demonstration? Yaakov, we got one.
Yay.
We got Yaakov.
Thank
Okay,
you.
Yaakov saved the day.
Yay.
I really had a lot of it, and I'm ready to do it.
Excellent. I got to get a piece of paper because you can't do this without paper. All right. So, Yaakov, the person that you're playing, I encourage you, don't pick one client, pick like a compilation. And the reason I say that is because sometimes people pick one client, and then if I ask questions that are different than what you've asked your client, people get stuck. So just sort of pick like a type of client and then just sort of flow with it. Are you okay with that?
Sure.
All right.
Is that about me or about the client?
Whoever you're playing for the client.
Okay.
Yeah.
Okay.
So what kind of client are you playing? I don't want to know pathology, anything like that. Just what would I see that is different from what I see on my screen right now?
A big frown.
Well, just as far as, are you playing a woman? Are you playing a kid?
It's adult.
An adult?
An adult man.
Okay. All right. Perfect. So I'm just going to jump into the conversation. Can I use your real name? Or is there a different name you want me to use?
You can use my name.
Okay. All right. Hey, Yaakov, how are you?
I'm so depressed. Sometimes I'm so manic. Sometimes I'm so depressed. I'm so lost, like at my own identity.
I'm glad you're here. How were you able to get here tonight?
I didn't hear that one.
How are you able to get here tonight with everything going on for you?
Well, I took the courage and I told myself I have to get myself through all this, and I have to get myself together and take care of it.
Are you that kind of person that if you just tell yourself, I have to get it together, that you do it?
I'm glad you asked me that question because sometimes I feel like that, but sometimes I don't.
So what made the difference tonight? So you were able to do that?
Well, I was in the state of mind that I want to take care of myself.
Okay. Is that different?
Different than what?
Other times?
Sure, because sometimes I'm depressed and lost with myself.
Okay. So what happened that you were able to do this tonight, even though that's not always the way it is? What made the difference?
Well, my mood was just on the high end.
Okay.
So I decided to take care when it is at the low end.
Okay. So you're able to know when to take care of it and when you can take action.
Yeah.
What's the secret? What's the secret of knowing when you can take care and take action?
The secret is actually my own self.
How so?
What?
How so? How do you do that?
Well, I dwell into myself and I see my courage that I have and I use it.
Okay. Okay. So to see the courage and use it. Okay. So how are you hoping that us talking tonight would be helpful?
To see that I actually have the courage in me to do it. And even when I don't feel like doing it, know that I have it and I can use it.
Okay. Okay. Who might notice this if you were able to see your courage and use it?
me when I'm tuned into myself.
Okay. Anyone else?
Well, all my surrounding friends and family when they see me coming out.
Okay, to your friends and family. So let's say that we have a good conversation. What would be different tomorrow that would let you know, wow, that was helpful?
That when I have the down to get up and do what I have to do.
So what would that look like tomorrow if you got up and did what you needed to do?
Attend my daily functioning, what I have to do.
Okay. So like paint me a picture of that. What would your daily functioning look like tomorrow?
When the alarm clock rings, get out of bed, even when I feel like just pulling out the wire or pressing the snooze button.
Okay. Can I ask you some more questions about that?
Sure.
Okay. So I want us to imagine it's tomorrow and the alarm clock goes off. How would you get yourself to get out of bed, even if you didn't feel like it? How would you do that?
By remembering and being in tune that I have the courage in me to do it.
Okay. That sounds a lot easier said than done. To remember you have the courage, right? So how would you actually get yourself to remember?
By putting a note at by my alarm clock, Yaakov, you have the courage.
Okay. When would you have written this note?
The night before.
Is it like a post-it note like this, or what kind of note? All right.
Post-it note that can actually be stick down to my alarm clock.
Okay. And when your alarm goes off and you see the note, some people would just take the note and throw it on the floor. But if things were good, what would you do when you saw that note?
What would I do?
Yeah.
I would have my mind like fluctuating between not getting out, but getting out, but pulling off the note, but not pulling off the note. And then getting myself together and like focusing on it and see that actually, yes, I can do it.
Okay. So you would get through that back and forth. Okay. How did you change the going back and forth and turn that into focusing? How would you have done that? Is it something you said, something you did? How did you do that?
By actually tuning myself to what's going on and what I can do.
Okay. Okay. What difference would it make for you if you actually remembered you have the courage and were able to focus and get out of bed? How would that change things?
Show myself that I can actually have overcome my emotions and feelings even when it's hard.
Okay. And is that a big deal for you to
Very
know
big
that?
deal. Very big deal.
Okay. How would that change things for you to know that you're the kind of person who can overcome those feelings even when it's hard?
That will make me feel like I can live my life like a normal person. And that's what matters to me.
Okay. So that's important. Okay. So how will you remember to write this note?
I will remember it by putting in a reminder on my phone.
Okay. And how will you remember to do that?
Right now, by the session.
Right now? Okay. All right. All right. So I know we're almost out of time, but I want you to really notice tomorrow, how do you get yourself out of bed? I want you to really notice, how do you get yourself to focus? How do you remind yourself you do have this courage? You are able to manage those emotions. And just notice whenever these emotions come, how you're able to remember this. Whether it's the Post-it note, whether it's the note on your phone, I want you just to notice that and then bring that back.
Thank you very much. I had a lot of the session today.
Okay. So let's just stop right there. What was this like for you as a client? What worked?
Amazing. Amazing is not the word. It's much more.
Yeah. What was helpful here? What did they do? They got you to think different.
Just by making me aware. Aware is the word. The word is aware.
Okay. Thank you for doing this with me.
Thank you very much.
Thank you for letting me.
Round of applause for you. And one of the things that I'm sensing is there's a very deep vividness that's being created in the imagery, of what this is going to look like, that, you seem to be really dwelling on creating that very, very vivid, very real, very in front of your face.
Yeah, very much so. And it's such a nice example of that we didn't go very far into the future, right? We started with how he even got here today. Those are called coping questions. Really pulling out, here's a person that was really struggling. I always say people always bring two stories into the room. They bring the story of pain or the story of struggle, but they also bring the story of resilience, the story of hope. So you heard Davik start in right away with the story of struggle, the story of pain. I honored it and then got curious about how were you able to get here today? How were you able to do that? Right? And to pull that out through coping questions. And I did that before I even got to that first third about what does he want?
Amazing. Okay, well, thank you. That was a great, great demonstration. Thank you, Yaakov, for being such a well-behaved and compliant client. I think Chava has a question about that. Chava, could you unmute him? I'm trying to ask you to unmute. Chava? Are you having a hard time unmuting? Okay, let's go to Shendel. And Chava, when you figure it out, let me know. Shendel, go ahead.
Okay, so basically on the same direction as Chava, he is a very attuned client and he knew all the answers pretty much. What do you do with a client that, first of all, is resistant, and second of all, like, I don't know, like, what brought you here today? Okay. My wife made me to.
Yeah. Great question. So let's start with resistance to start with. Solution focused, we don't believe there's such a thing as resistance. It's not like motivational interviewing. So solution focused, we believe every single client is 100% motivated. They just might not be motivated for what you're selling. So my job is to discover what they're motivated for. Really, really different. Now, as far as those I don't knows, like the example that you gave about, my wife made me come. I'm going to say, wow, do you do everything your wife tells you to do? I have never seen a human being that says, yes, I do, right? In fact, they're going to proudly probably say, well, no, okay, what made you decide to do this? Well, I want my wife off my back. You see how that person is 100% motivated to get their wife off their back? That's what I mean. They're 100% motivated for something, and it's my job to figure out what that is, okay? Now, I don't knows. Oftentimes people worry about I don't knows. And there's a few different kinds of I don't knows. There's the most common I don't know, which really means shut up, I'm thinking. right? You know, it'd be no different than if I said to you guys, what are you having for dinner tomorrow? Wouldn't most of you say, I don't know, right? Does that mean you're trying to be difficult or you're not capable of feeding yourself? Of course not. It means that you weren't thinking about that. But if I say to you, you'll be having dinner, you know, tomorrow night in 20 some hours, where are you going to be at dinner time? Are you going to be at home? Are you going to be out and about? Who are you going to be around? Do you like big meals, little meals? Do you see the more I hold you there, the more you start thinking about what you might eat for dinner, right? So I don't know is actually a huge compliment to me as a therapist because it means I'm getting you to think in a direction you weren't previously thinking before. And as a solution-focused therapist, that's the greatest compliment you could ever give me because you come in with a story of pain and I'm shifting you to the story of resiliency. So I expect I don't knows. You heard that with Yavik. He didn't use I don't knows, but you could tell he was like, what? And sometimes he'd like, no, what did you ask? You asked that again? As I was shifting him from focusing on what's wrong to the story of resilience. That's normal. Now, the third kind of I don't knows is what I call an attitude I don't know, which is I don't know. That says you don't have their hearts. You're working off someone else's agenda. And that is when I always have to shift and say, what matters to you? I know why your wife wants you to come, but what are you hoping to be different? And if I shift and get the correct agenda, there will be no such thing as an attitude. I don't know.
Well, somebody's asking someone's asking in the chat box, what about the I don't know that's I know, but I don't want to tell you?
Yeah, that's the attitude again. And that's usually what you will find if you're going after someone else's agenda. Or if you're going after problem, right? Because human beings do not like to be asked questions about their weaknesses, their flaws, their problems, their pain. And we never ask questions about that. Like with Jakob, I've never asked any questions about his pain, his depression, his struggle. I asked about his success. How were you able to get here today? I asked him about what he wanted. You don't get those kind of attitude responses to that. People try to protect their pain and their struggle, but they're not going to try to hide what they genuinely want. They just don't do that.
Teri, I want to ask you a question about a different kind of problem, if I may. Let me bring in two different circumstances.
Mm-hmm.
And let's see if how we would address this. Let's one circumstance would be somebody who's really struggling with friendships or social skills.
Mm-hmm.
So whereas many therapists would jump into psychoeducation or teaching. Yeah. And another question, this is a client that I'm working with currently who says she's an 18-year-old girl and she's in a relationship with a 19 or 20-year-old boy. And she says she doesn't like to share. She doesn't like to share her feelings. She doesn't like to make herself vulnerable. And in fact, she doesn't really even know how to talk about her feelings, but she doesn't even like to share stuff that went on in her day. It makes her feel, though she says it, she's not very emotionally attuned. So she says, I don't see the point of it, but I want to learn how, because I know that this is how you have good relationships with people, and this is how you have deep relationships, and I want to be able to, but I hate doing it. Let's talk about the second one.
Okay. I would ask, well, why do you want to do it then? What lets you know that having a relationship would be...
I know that I'm going to have a good relationship. I know that that's how you have good relationships. And I know I have to do it to have a good, meaningful relationship.
Oh, where'd you come up with that idea?
Well, that's just what I heard. I heard from everybody. It just makes sense to me. But I hate doing it.
Okay. So then I would say something like, so if we were to put this on a continuum, Where up here, you've got people that just spill their guts about their life, their day, all that. That's just how they are. And these people over here are more private. They keep all that more personal. We're all on here someplace based on our personality, not our skill, but our personality, about what feels good to us, what helps us get through our day. Where are you based on your personality?
Oh, I mean, way on the bottom. Way on the bottom.
Over here?
No,
okay.
No sharing. Doesn't make sense. Doesn't make sense to me.
Okay.
That's annoying for me. But my boyfriend, and he's annoyed that I don't.
Okay. So here's a really important concept, is that if we're really going to do well in relationships, we have to be ourselves and not try to change to be someone we're not. So in this future place, when you are in a relationship and you're able to be yourself, be your true personality, what would that look like?
Well, that would look like that I wouldn't really share anything unless I had to or I really wanted to. And
how would you decide?
And my
when
boyfriend
you
would.
to?
How would I decide what I wanted?
How would you decide when you wanted to?
Well, I just would have to want to.
Okay. How would you decide how much to share? When to share?
But whatever I need to, only going to share what I need to share for him to know.
Okay.
It's important that he knows. Well, if it's a piece of information that he has to know because he has to do something to take care of it, then I would share it, and if not, I won't.
Okay. Okay.
But he's not going to like me. He's not going to like me if I don't. If I only share the bare minimum of what needs to be shorn.
So in this future place, how would you decide if you would even keep him? How would you decide if he's even the right person? Because again, in good relationships, we don't change to make other people happy. We accept each other the way we are.
But Teri,
so how would you decide?
I don't think I'll be able to be in a deep relationship with anybody the way I am. So it's going to be him because I like him and I want to make this work.
Okay. So in this future place, what would that look like? How would you decide when to push yourself in a way that you felt good about too?
Well, again, I'm only going to share things that have to be shared. Okay. If he needs to know about it, then I share. And if it's just something personal that elicits empathy or sympathy, I don't want to do it.
Okay. And what would he see in you that lets him know that this is working for him as well?
Well, he's probably going to get more and more frustrated with me.
Okay. So in this future place, what would you choose?
So are you saying, Teri, that I'll never be able to sustain a relationship with him?
That is not what I said. It may not be with this person, but in the future, I don't know. You're the expert on him. I've never even met him.
Right. But I'm saying that
possibility.
He needs me to be vulnerable and share it, or he's going to get frustrated with me.
And is that
I can't do that.
Okay.
But I want to learn how to be able to do it. I want to be able to become vulnerable and share. I just hate doing it.
Okay. So what would that look like in the future if you were comfortable being vulnerable and sharing? What would that look like?
That would mean that I would either be okay with having him be compassionate towards me, or I should say empathic towards me, which I'm really not, but that's what it would be.
Okay. Yeah.
Or I would do it because that's what he likes.
Yeah.
Even though I don't really like it, I'd get over not liking it and do it anyway. Become okay.
Are you that kind of person that can just shove your feelings aside and do what you don't want to do?
If I know I have to do it, then I can.
Okay. Like forever or like a week?
I mean, I'm very determined. If I need to do it, I could probably do it. I'll never like it, but I'll probably be able to do it.
So what would let you know that this relationship was even worth it if you were doing these things that you don't even want to do?
I guess if I started getting really angry and resentful, then I would know that this is not worth it.
Okay. Okay.
Which has happened once or twice over the course of our relationship, but I'm still very determined to make this relationship work.
Okay.
But I hear what you're saying.
Okay. So let me just stop right here to talk this through. So again, it has to be in the future when both people are happy. This is no different if she was saying she wanted to be taller. Does that make sense?
Yeah.
That
was last week's complaint, by the way.
Yeah, but it really is. My job is to help clients to really figure out what do they know about themselves.
I see what you're doing.
You know, and oftentimes we all have these continuums, whether it's external, like an introvert versus an extrovert, right? Or a morning person versus a night person, right? That there's certain things that's just about how we are wired, right? It would be very different if this person was saying, actually, I'm just scared. You know, it's like, I want to be able to be that way. And sometimes I can, but it's just fear. That's not what you were saying. You were
she's
saying,
not giving me the luxury of being so complacent and simple. She's very rigid, very not, you know, her EQ is poor. Her intelligence level is high, actually very high, but her emotional intelligence is poor, and her I would say her willingness to look inside herself is poor, but that's not really true, because she just may have a poor emotional intelligence and not have so much.
It just might be her personality.
Yeah, but what I'm feeling as you do this intervention is you're unstucking a lot of my dead ends. You know, these rigid thinking patterns, right? I'm feeling are opening, and you're kind of like, I feel a little bit more peripheral. Like there's room to look this way and that way, and not just like this is it and this is all it is.
Yeah. And you heard me do what I call just statements of fact. That is nothing about this client, because I don't know this person's answer. But what we do know is that when relationships go well, it's two people coming together, not trying to change each other. We know that. And so you heard me make a statement of fact that if you have to change your personality to be with this person, that's not what a good relationship is. It's two people coming together.
What if you know, again, then you're bringing your own bias, aren't you? I mean,
actually, that's supported by research. That's what I mean about statement of fact. Those are research statements. That has nothing to do with
change
life according to me.
But I want to change myself. I want to change my personality.
Yeah.
I want to be able to share and be comfortable with it.
Okay. And what if you were a client, I would say, you know, there's things about our personality that it's just what we bring to the table, like the extrovert, introvert, right? An introvert can go out and be sociable, and yet it will still drain their battery, right? That's not what gives them joy. And so you've got to figure out for yourself.
Okay. Are you still? I mean, okay. I guess you're still going within the model that the client's the expert on themselves, but you're also saying that they're deluding themselves by thinking that they can be different. Because you're saying
I'm asking them.
Yeah, no, I think I could be different. I think I could break through this anxiety of not being able to share, and I think I can get there.
See and what you did right there? Completely different language now. Now it's a completely different client, because now you're saying it's about anxiety. That is not about personality. That's a completely different client than what you were playing before, right? So now with this new client, then we would focus on, in the future, how would you manage that anxiety? How would you decide when to push yourself and when to pull back? That makes sense how that's a completely different client you just turned into.
Well, the clients will vacillate, obviously, you know. They won't.
I don't experience that in 30 some years.
That clients kind of change their narrative of themselves. They present themselves a certain way and then sort of understand themselves more and change that.
They definitely grow, but what I find is when therapists are playing clients, they do exactly what I just experienced with you, is it changes dynamics, but clients don't do that.
Because
that's exactly right. Yeah, that's exactly right. So once you understood it, you changed the kind of person you were playing. Clients don't do that. That's the difference.
I see. Okay. Can we take one more question? Teri?
Of course, of course.
Elliot, you're on.
Teri, I really appreciate what you're saying, and I do a thing called paradox, and you're very aligned with what I do. First of all, I would say that you said you don't have a theory. I think that you actually you do have a theory of not having a theory.
Yeah, I would agree with that. Right. Very good, Elliot.
And so I've heard no power struggles. I see you don't power struggle with anybody. Warmth, empathy, genuineness, acceptance, truly just being there with the client without an agenda, which is, I know that when I teach what I do, that's the hardest thing to teach people. You don't have to have an agenda. And no, but you have to, we want to change something. You don't have to have that. My question is with Moshe, at least with his case, would you ever use absurdity? Meaning to say, Moshe, you're right. You could never really reveal anything about yourself. And why don't we just plan that you're going to see your boyfriend and and I know you're not going to talk about anything meaningful or your feelings. So, and I accept that. I'm not trying to reverse psychology here. I'm just saying that I simply accept that you can't do this, that you're saying you can't do it, and I believe you.
Yeah, I want to stay focused on what do they want, because I'm not hearing that that's what this person wanted, right? So if they were saying that it will never change, I'll never be able to, then where I would go with that, Elliot, is I might say, well, then you must have a good reason for coming. What are you hoping might be different? So what I'm looking for is that exception. On one hand, they're saying they'll never, ever change, but that doesn't match with the fact that they made an effort to show up. So I want to get curious about what is it that you know about yourself that lets you know, even though, I might never change, it's worth coming here, right?
Yeah, I wasn't saying that the client, from our perspective, yes, of course you can open up at any time and share with your boyfriend. But at least I sensed with Moshe that he was kind of like egging you on a little bit, kind of like, can we get into an argument about this, that you're going to try to get me to change and tell me that it's really good to share. And sometimes if a client does that, I just kind of say, well, maybe you're right. Maybe you really can. Not with just kind of I'm not trying to get into a power struggle with them.
Yeah. I really like, Elliot, how you're really aware there is no power struggle. There is no agenda. And so it completely diffuses that. Right. And I'm just, anytime it even builds, I'm like, then how can I help? What do you want? That's sort of like the reset. That's the touchstone I always go back to. So what do you want?
Right. And to my earlier point, which again, a lot of it was actually influenced by some of Elliot's work. To my earlier point, if and Teri, you used the words not ruining it, right? To my earlier point, the client who feels the greatest attachment with the therapist is the one who the therapist does not have an agenda and can sit with them and where they're at. So to my point that when I asked you earlier, what's your hypothesis of how change happens? You're saying that solution-focused therapy is so successful. I would venture to say that it's successful because the therapist is so focused on being present together in wherever the client's at, that the attachment is so strong. And that's probably, again, in my mind, where the change is happening. And I think Elliot would agree with that. I don't know if Teri would, but I
wouldn't.
Yeah.
Because it's about connecting with what they want, not necessarily connecting just where they are in the moment, right? They want something. They really want something or they wouldn't be here. So I have to really hear, what do you want? And then, yes, there is that connection with the human being. But if I just connect with the person without connecting with what they want, I'm not so sure change would happen.
Okay. That's probably where we're disagreeing right there.
Yeah, it's a different theory.
That's right. Okay, is it ID?
Yeah.
Hello.
Hi. So, Teri, you're saying words like "How can I help?" or "What do you want?" And what if the clients said, "What I want is advice. What I want is psychoeducation." You know,
Okay.
which takes you away from solution focused.
Yeah, it doesn't have to take me away from solution focused. I would say, happy to give you advice. Can I ask you some questions so I give you the right advice? I don't want to make your problems worse. So see, the big thing that's happening right here is I know that I don't hold their answers. So I'm not going to allow them to trick me into start giving answers. But if I say, happy to give you advice, can I ask you some questions first so I give you the right advice? Through the questions, I will pull from them what they want and what works for them, right? So, I mean, let's go back to that demo I did. I apologize. I forgot your name.
Was it Yaakov?
Yes, Yaakov. So let's think back about the conversation with Yaakov. Like if he had said to me, give me some advice. And I said, hold on, let me ask you a question so I give you the right advice. Think about all of the wonderful wisdom we got from Yaakov, right? About how important it was for him to be able to see his own courage, that reminders were helpful, right? So I heard that from him. So at the end of a session, if he had said, please give me advice, the advice I would give is, Yaakov, it's very important for you to see your courage. It's very important that you find ways to remind yourself, whether it's Post-it notes or reminders on your phone. I want you to do that. You see how I can give any client advice, but what I know is it has to come from the client, and that's where I'm going to get that advice. So we use the client's language. So if what they say is, I want you to teach, I want to give advice. All right, let me ask questions, and then I will pull that, and then I will give you the advice to do that. And what I find is clients who want.
So there is room for the psychoeducation once.
No, there's no need for psychoeducation. In 30 some years, I've never needed to do psychoeducation because the client always knows. Like I use the example about the therapy dogs that I use and I train. You know, I have a dog right now that I'm training to be a therapy dog, and I've been teaching her how to sit and lay down and roll over and stay. Do you think the dog never sat down before I taught her how to sit? Do you think she never laid down before I taught her the command down? Of course she did. All I'm doing is helping to connect a word with the behavior she came to me knowing how to do, right? So the same thing with a client who's anxious. Do you think they've never taken a deep breath before we taught them breathing exercises? Of course they have. Do you think they've never left the room before you taught them time out? Of course they have. They may not have called it those things, but they know how to do anything you could possibly teach them. So if you ask the questions and you pull out the skill, then if what they're wanting you to do is educate them, just label it and say, oh gosh, that's just like deep breathing that I oftentimes, have learned that helps with anxiety. That's a wonderful tool. And then I might ask, when you breathe in and you feel calm, are you breathing in through your nose or are you breathing in through your mouth? How long do you hold that breath? Are you exhaling through your nose or through your mouth? You see how the client is telling me how they do that technique? I don't need to teach it if we learn to ask the right questions. And what I find is it's so much quicker if we pull it from the client, and they're much more likely to actually use it than if I had been the one to tell them.
So here's my question coming with it. So let's say when you do therapy with, let's say I'm giving one client, woman who has conflict in marriage. Mm-hmm. I find that by teaching and discovering a lot of nonviolent communication, she sees a tremendous change in her life. Well, that's still psychoeducation.
Mm-hmm. Yep, it is. And I am pretty sure I could get to the same place using solution focused without having to teach. I would just do it through curiosity and asking times when she is able to have a conversation, maybe not with her partner, but somewhere else. And she and that person walk away both feeling good about that. It might just be at the grocery store. Maybe there's a disagreement over a price of an item, but they both walked away feeling good about that interaction. How did that go?
So you would get that concept
Yep.
by allowing them to draw it from their own knowledge.
That's exactly right.
That's right. And I imagine idea, of course, that if they can pull that from themselves, there's a much deeper precedent that they have, and it's much more familiar and probably more empowering than if they're taking outside information that goes against a negative pattern that they're constantly applying and trying to apply a new concept that somebody's teaching them. So there's something about like a self-discovery almost that's happening in this process.
Very much so. Very well said.
Beautiful.
See, you got it.
I finally got it. See that?
You got it. An hour and a half, we got it.
Right. It's 87 minutes, and I think I'm done. But that's what we do. We figure it out. We learn.
We figure it out.
Well, I really appreciate, Teri, you joining us tonight. Time's getting late here on our side of the planet on the East Coast. I know you're still a couple hours behind us, but between everything, it's 10:30 here. And so I really, really want to thank you for joining and sharing this with us and making it experiential so that we get a really good sense of what we're talking about. I want to encourage everybody to please visit Teri's website, which I put in the chat box. It's denversolutions.com. I did forget to mention, but it's important to say that Teri has authored 5 books in all kinds of different languages. I'm going to just share the screen for a minute so you can see what it looks like. Not languages that are familiar to my eye. Okay, so here we have Chinese and Japanese. For those of you who can tell which one is Chinese and which one is Japanese, you can let me know. We have French, and this one looks like it's actually English.
Yep, that one was translated into Spanish as well. I may not have posted it.
Yeah, I don't see that on here, but we have Spanish for those of you who have Spanish.
Yep.
And so please take a look at the books, take a look at the website. You're very welcome. And for those of you who are thanking us in the chat box, and we'll post this online and send it out for those who were unable to watch it live. And again, thank you.
My pleasure. And thank you so much, everyone who jumped in, asked questions, did role plays.
Turned on their videos. And for those who couldn't. Okay. Good night.
All right. Bye-bye.
Thank you so much, Teri.
You're welcome.
For those of you who want to stay on just to say hello.